The transition to a value-based basis for payment in healthcare is extraordinarily important. In fact, I see it as where we find our soul again in medicine.
The transition to value-based care is important in today's healthcare environment because not only are we spending way too much on healthcare, but we're not getting very good outcomes. So it's going to be a lot better for physicians because right now, if a physician is really doing those things like shared decision making, explaining to a patient why they don't need a test, spending more time to reconcile their medications and make sure they're not having drug interactions, then they're actually getting paid less than the people who crank patients through. So it's not fair to the really good high-value doctors now. In addition, it's going to be a lot better for physicians because the changes they need to put in place actually make practice easier and more enjoyable. So we're sort of redesigning care to get there, and that redesign works a lot better and takes a lot of the stress out of practice. And I think it's going to be a lot better for patients because patients are the ones ultimately spending the money, the premiums, the deductibles. They get care they don't need. And not only is that costly, but it can put them at risk.